Chlorhist is an antihistamine used to relieve symptoms of allergy, hay fever, and the common cold. These symptoms include rash, watery eyes, itchy eyes/nose/throat/skin, cough, runny nose, and sneezing. It works by blocking certain natural substances in your body that are produced during an allergic reaction, helping to dry up some body fluids to relieve symptoms such as watery eyes and runny nose. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. It's important to note that these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy, and do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Chlorhist, it's important to carefully follow the directions on the product package, or as directed by your doctor. You can take the tablet, capsule, or liquid form with or without food, and if stomach upset occurs, you can take it with food or milk. If you are using the extended release capsules, be sure to swallow them whole and do not crush or chew them. If you are using the liquid form, make sure to use a medication measuring device to measure the prescribed dose, and shake the bottle well before each dose if it is a suspension. Your dosage will be based on your age, medical condition, and response to therapy. It's important not to increase your dose or take this medication more often than recommended without your doctor's approval. Take this medication regularly at the same times each day to get the most benefit from it. If your condition lasts or gets worse, or if you think you may have a serious medical problem, be sure to seek medical help right away. If you experience drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat, it's important to let your doctor or pharmacist know. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. If you are using a sustained release product, you may notice an empty tablet shell in your stool, but this is harmless. Your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. However, it's important to let your doctor know if you experience any serious side effects, such as mental/mood changes, trouble urinating, fast/irregular heartbeat, or seizures. While a serious allergic reaction is rare, it's important to seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed, be sure to contact your doctor or pharmacist. Before taking Chlorhist, it's important to let your doctor or pharmacist know if you have any allergies to chlorpheniramine, dexchlorphenamine, or any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, glaucoma, heart problems, high blood pressure, liver disease, seizures, stomach/intestinal problems, an overactive thyroid, or trouble urinating. Chlorhist may make you feel dizzy or drowsy, and can also blur your vision. Avoid alcohol or marijuana, cannabis, while taking this medication, as they can increase these effects. It's best to not drive, use machinery, or do anything that requires alertness or clear vision until you can do so safely. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana, cannabis. If you experience dizziness or lightheadedness, be sure to get up slowly when rising from a sitting or lying position. For liquid products, it's important to note that they may contain aspartame, sugar, and/or alcohol. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, it's best to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that older adults may be more sensitive to the side effects of Chlorhist, especially drowsiness, dizziness, confusion, constipation, or trouble urinating. This can increase the risk of falling. As for children, they may be more sensitive to the side effects of this drug, and it can often cause excitement in young children instead of drowsiness. If you are pregnant, it's important to use this medication only when clearly needed, and to discuss the risks and benefits with your doctor. Based on information from related drugs, Chlorhist may pass into breast milk, so it's best to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that may change how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Chlorhist are antihistamines applied to the skin, so be sure to tell your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. It's also important to check the labels on all your medicines because they may contain ingredients that cause drowsiness. Chlorhist is very similar to dexchlorphenamine, so do not use medications containing dexchlorphenamine while using Chlorhist. Additionally, this medication may interfere with certain lab tests, potentially causing false test results, so make sure lab personnel and all your doctors know you use this drug. If someone has taken too much Chlorhist and is experiencing serious symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. You can call 911 or your local poison control center. Symptoms of overdose may include dilated pupils, flushing, fever, hallucinations, weakness, shaking, muscle twitching, loss of consciousness, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Always seek medical help in case of an overdose. If your doctor has prescribed Chlorhist, it is important not to share it with others. Be sure to keep all medical and lab appointments as directed. This medication is used to relieve symptoms of allergies, such as runny nose, sneezing, itching, and watery eyes. It may also be used to treat itching and swelling caused by chronic urticaria. Take Chlorhist by mouth with or without food, as directed by your doctor. If you are using the liquid form, measure your dose with a special measuring device/spoon. The optimal timing for taking this medication may vary, so be sure to follow your doctor's instructions carefully. If you forget to take a dose of Chlorhist, take it as soon as you remember. However, if it's close to the time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Chlorhist, it's important to keep it at room temperature and away from moisture and light. It's best to avoid storing it in the bathroom, and if you have the liquid form, make sure not to freeze it. And of course, always keep medications out of reach of children and pets. When it comes to getting rid of Chlorhist, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it has expired or is no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.